A cervical stitch, also called a cerclage, can save a pregnancy when the cervix begins to open too early. But when do doctors recommend it? How is it done? And is it painful? Today, I'll explain everything you need to know about cervical stitch in a simple, reassuring way. A cervical stitch is a procedure where the doctor places a strong thread around the cervix to keep it closed and supported during pregnancy. Think of it like a seatbelt for the cervix. It prevents the cervix from opening too early and reduces the risk of miscarriage in the second trimester, premature birth, pregnancy loss due to cervical incompetence. The stitch is usually removed around 36 to 37 weeks. When the baby is ready, a cervical stitch is recommended when the cervix is weak or shortening too early. Doctors suggest it in cases like 1. History of second trimester miscarriage, especially painless loss where the cervix suddenly opened. 2. Short cervix on ultrasound if the cervix measures less than 25 millimeters before 24 weeks. 3. Cervical incompetence where the cervix opens without contractions. 4. Previous preterm birth, especially before 34 weeks. 5. After cervical surgery, such as cone biopsy or LEPI procedure, which can weaken the cervix. It's one of the most effective preventive treatments in high-risk pregnancies. There are 3 main types. 1. Prophylactic, planned cerclage. Done early, usually at 12 to 14 weeks for women with a known history of cervical incompetence. 2. Emergency or rescue cerclage. Done when the cervix is already open or membranes are bulging, usually before 24 weeks. This is a life-saving intervention but risky. Success depends on timing. 3. Ultrasound-indicated cerclage done when ultrasound shows the cervix shortening but symptoms are mild. Each type depends on your medical history and cervix condition. The procedure is usually straightforward. You receive spinal anesthesia or light sedation. The doctor inserts a speculum and places the stitch around the cervix. It takes around 30 minutes. Most women go home the same day. Light cramping or spotting for 1 to 2 days is normal. The stitch does not hurt the baby and usually does not affect daily activities after a short recovery. Although generally safe, here are things to keep in mind: mild bleeding or cramps, infection, rare, premature contractions. Water breaking early, rare but possible. Doctors usually recommend avoiding heavy lifting, avoiding intercourse for a short period, monitoring for pain, leaking fluid, or bleeding, more frequent cervical length scans. Most women with cerclage go on to have a healthy, full-term pregnancy. The stitch is normally removed at 36 to 37 weeks before labor begins. Removal is quick and usually done in the clinic without anesthesia. Labor and delivery after cerclage is typically normal. However, if labor begins early or the water breaks prematurely, the stitch is removed immediately. A cervical stitch can be life-saving for women with a weak or shortening cervix. It supports the pregnancy, reduces the chance of miscarriage and preterm delivery, and gives your baby the best chance to grow safely. If you want videos on short cervix symptoms, bed rest tips, or high-risk pregnancy care, comment below. I'll make them next.